back. This is Boomer Life on CL 650.
Living in the moment, living my life.
We are back on Boomer Life. I'm George Gordon, and today we're talking about Parkinson's disease, changing the perceptions about it and living well with this condition. We have been hearing from the experts who are researching this. We've been talking to the folks with ParkinsonBC about the work that they're doing. Now, I kind of steered the questions a little bit off, and I didn't give a chance to give our PhD candidate and researcher, Matt Kelly, a chance to talk about the study that you're actually doing on the disease. Tell us more.
Yeah, so what we're, as I said earlier, we're really trying to get at the mechanism, and we're quite fortunate at UBC to have a program with the physics department called TRIUMPH. And TRIUMPH is a cyclotron that we're able to make radioactive material, and with that we can do an imaging technique called PET, or positron emission tomography. And what that allows us to study is specific cellular behavior in the brain of active living people. So what we're doing with Parkinson's disease, we know dopamine is an important neurochemical or neurotransmitter in the brain, and we can study the behavior of dopamine within people who are alive. So we're looking at how exercise might affect dopamine release, for example, is one way, and we can look at that with our imaging, and we're also looking at how exercise might affect neuroinflammation. So there's a theory within the disease that there might be an initial inflammatory response at a cellular level that occurs in the brain when people get diagnosed or even prior to diagnosis. And as this inflammation becomes chronic over time, that actually might contribute to the progression of Parkinson's. And what we're trying to look at is to see if exercise actually decreases the amount of this inflammatory response, which would actually be beneficial, and that might be one of the mechanisms that is actually contributing to the therapeutic approach of using exercise for Parkinson's disease.
Fantastic work, continued success. As we've said with Parkinson's, we don't know what causes it, we don't know what's going to cure it, but we sure are doing a lot more about learning how to deal with it, in your research, and Silke Cresswell's going to be so important. Continued success.
Thank you very much.
All right, now we're going to talk to Ruthanna Metzger, who has been so busy working with something that seems so simple but is proving to be, as much as exercise in some individuals, in some cases, so important in dealing with Parkinson's. Ruthanna, welcome to the show.
Thank you.
All right.
Glad to be here.
Tell us about Songshine program.
The Songshine program is kind of an all-encompassing program. We started initially with Vocalese, which are classical singing exercises. I have a doctorate in voice performance, and my focus as a university teacher was to always build good vocal technique. And then because I had worked with speech therapists and otolaryngologists in a type of consortium comparing our work, I began to wonder if the use of classical singing exercises could strengthen a Parkinson's patient's voice. And at the invitation of Eisenhower Medical Center down here in Southern California, they asked if I would set up a class, and so we did a pilot study, and we had phenomenal success. We discovered that those simple exercises then combined with singing music that was well known, even music that they didn't know at all, really had a profound effect. And the reason it did was because breath flow is essential for freeing the voice. And then the Songshine program expanded. I added a partner, a gentleman who had trained at Juilliard in Shakespeare in the drama division. And of course, his emphasis in Shakespeare was diction, articulation, the use of the tongue, facial muscles, the lips. And we put that together with role playing and what we call creative drama and emotional engagement. And we discovered that Parkinson's patients that were perhaps afraid to sing or didn't have any connection to music could also be brought out, the voice could be brought out through playing a role or assuming an identity other than their own. Something like drama therapy, I suppose.
Well, that's amazing, because that has worked with people who have stuttering issues. That that is one of the treatments or the therapies that have been used. Have you got a couple of stories that you could share with us from people where it's made a big difference in their life?
Oh, I certainly have. Let's talk about Dr. Wayne Curtis. Wayne came to our class because his partner forced him to. He was a clinical psychologist, and when he retired, he had planned to spend his retirement years singing. He sang at a highly professional level, working his way through Columbia University as he was getting his PhD. And then the last year of his practice, he began to see these incredible signs that he knew were probably pointing towards Parkinson's. And so he became a recluse. And then he was brought by his partner to our class, and within less than a month, Wayne was singing again. He made a beautiful CD that he donated to the foundation, and he was out doing karaoke, singing concerts, and his life was literally transformed, because it reconnected him with something that he had a passion for. I had another gentleman by the name of Harry. Harry came through the door, and I was embarrassed. I couldn't understand a thing Harry said. He had Parkinson's with a very weak voice, very stuttery. Harry had been an accountant. He didn't have a music background. He started singing the vocalies and the songs, and within 2 weeks, Harry was very loud. I mean, you could hear him carry on a conversation, talk on the phone, and it all goes back to the fact that when we sing, more parts, more areas of the brain light up than any other thing that we do. It's amazing. And then, as I said, when you engage them at an emotional level, it's astounding. Those are two. I can give you a lot more.
Well, it's amazing sometimes the simplest things that you discover that can help you deal with a critical issue. And obviously, you're giving hope. You're making people feel better about themselves. You are giving them a sense that they can fight with this disease with a degree of success day after day. Continued success with your work, and we hope to hear more from you and Songshine in the years to come.
Thank you,
I
and
hope
George.
so. And we're looking forward to doing a training at up in Vancouver coming May 12 through 14. And we'll be training instructors or teachers to use these methods to really empower the voice. It's all about freeing and empowering the voice and stimulating the brain.
Wonderful. Okay, give me the dates again and where this is going to be.
It's May 12 through 14, and all of the information is available on the website for Parkinson's Society, British Columbia. We're waitlisted right now, but if there is someone out there who's interested in exploring these methods, they should get in touch with PSBC, and you never know. We may have to come up a second time.
I think you would be welcome. Thanks, Ruthana. Now,
Thank you.
Now,
have a great day.
You
Thank
too.
You.
You too.
Bye-bye.
Now joining us, Sherry Zelazny. I got that right?
Yes.
M.A., RSLP, clinical speech language pathologist with extensive experience in evaluation and treatment of voice disorders. One of the things that you have made me aware of is the problem for people with Parkinson's in communication and swallowing difficulties and how to improve their situation. Tell us a bit about what you're finding your work in that area.
Sure. Well, we know that 90 to 100% of people with Parkinson's are going to experience voice and swallowing problems. It's not the same for everybody. It doesn't take necessarily a progression as the disease progresses. So you can have minor issues that maybe you can deal with, or you can have major issues anywhere along the road of Parkinson's. For voice, you've mentioned some things. The primary symptom that we see in people with Parkinson's with voice is a low vocal volume, so people get softer and softer and softer. The quality of voice can be impaired, so people might be a little bit hoarse, perhaps. It might be effortful to talk. And there can be tremor. So all the things that you've talked about today already, rigidity, tremor, stiffness, those things can affect the communication and swallow mechanism, and in turn that affects voice and the actual ability to swallow. So some of the symptoms for swallowing, and these don't always correspond, voice and swallow together, even though it's the same mechanism. And when I say that, I mean the larynx and the vocal folds and the mouth and lips and teeth and tongue and everything that we use to communicate and swallow. Regarding swallowing, there may be drooling. There could be coughing and choking, of course, is one of the primary things that we are concerned about. And that's quite obvious, but some of the other things that I try to help people with Parkinson's understand is that even if it's taking you longer to eat your meal, you may be having some trouble chewing, swallowing, managing food. If you have stopped eating certain items, you might want to think about why you've stopped eating them. And maybe it's because they're more difficult to handle and difficult to push down. And that all has implications to nutrition and health and your ability to exercise and how you feel every day. So everything is of course connected. It's a disease that affects the entire body. And when we talk about helping people with voice and swallowing, we talk about improving and maintaining quality of life. So there's very, very effective treatment, especially for voice. The Lee Silverman voice treatment is evidence-based practice. It's the gold standard for treating voice disorders and Parkinson's. And there's very effective both compensatory and rehabilitative or exercise for swallowing, for improving the strength of the muscles for swallowing. So there's a lot that we can do, and really as a speech pathologist working in this community, my goal is to help people to continue to talk and continue to eat, so that they can be healthy and have good quality of life.
So you can feed yourself physically, but you can also feed the soul, because if you can communicate, you're still in touch. You're still there.
Well, yeah, right, and that's so important. I mean, we're all here communicating. We're communicating with the public through this media, but communication, the ability to talk to somebody, to tell your family that you love them, to continue working, even going to the movies with a friend. If you're not able to communicate in those settings, then you start to remove yourself from those settings, and you don't feel as good about being as a part of society and knowing that you have something to contribute through communication. And the same with swallowing. We are quite rewarded by sitting down to eat with people. And if you find, if every Thursday morning you go for coffee and a snack, and you can't manage that anymore, or you're drooling, or you spill your cup, or then you take yourself out of that environment, and your quality of life changes.
And your mental wellness starts to suffer.
Right.
And your ability then to want to continue to fight is impaired.
And the good news is we can do something to help people. There's very, very strong evidence for all the therapies and exercises that we provide. And people would access that through a registered speech-language pathologist.
Now, this is all good news, and I guess the question has to be asked, because you're talking about programs, you're talking about treatments, which cost money. Is any of this covered by MSP?
So generally, occupational therapy, physiotherapy, speech-language pathology are not covered services by MSP. So something you would think of as going to an outpatient setting to the hospital to have outpatient services, unless there's a particular program provided in that facility, it's not going to be covered. If people have extended benefits and they have coverage for speech therapy, then our services are covered, but there's nowhere near enough coverage with extended benefits to take advantage of the therapy that's needed, that we know works for people. So one thing we've done with Parkinson's Society British Columbia is we've created a communication and swallow workshop that we take around the province several times a year, and our goal is to help people learn more about communication and swallowing issues with Parkinson's, know how to talk to their physicians about it, so that they can advocate for themselves for the services that they need, and start with some exercise. And exercise has been a theme today, and because we communicate and swallow with muscles, then exercise is important there as well. So we're trying to get out to the public, let them know what services are out there, who they need to contact, and that we can help. We can absolutely help.
Well, and this is very important, not just for the person who's fighting Parkinson's, but their caregivers, loved ones, often the spouse, who goes through as much trauma
Right.
in trying to, sometimes a helpless feeling, and this is an avenue to where they can be the coach, as it were.
Yeah, and when we do the voice exercises, either in speech therapy or at the communication and swallow workshops, the spouses, their faces light up because they hear their loved one's voice again. And that is a big emotional comfort for us, to hear voices that we are familiar with and hear somebody say, "I love you," again,
Wow.
when they haven't been able to say that because their voice is too soft or they don't have the power behind it.
Have you seen
To do it.
Have you seen some examples of a life turnaround?
Oh, absolutely, and I mean, absolutely. When I'm able to provide the Lee Silverman voice treatment, that is absolutely. I have people say to me, I never would have stopped working if I knew about this therapy, or I'm going back to my Thursday morning coffee, or I'm reading to my grandchildren
I think
again.
that's you talk about that one, the spiritual uplift, but also being able to continue working is important. If, as you say, some of these services are not paid for by MSP, or perhaps an extended benefits plan, you need some cash, right?
Right.
To put it bluntly.
Right.
And also being able to go to work is also important for the feeling of
Fulfilling,
self-worth.
yeah. Well, I do always say that I'm happy to help people be a taxpayer again.
Well, it is a cruel disease. The research that is being done, it's so rewarding to hear about this, and the treatments. What numbers? What kind of how big are your classes when you're working? What numbers are you working with?
Well,
at a
the
given time?
communication and swallow workshops, we do
Up to 40. Sometimes,
Well-
sometimes a little bit more.
yeah, so we do 6 or 7 a year, and we accept 40 or 50 people into the workshop. We haven't gone beyond that because I like it to be interactive, and we want caregivers to be there and really help people understand how they can be better. And they fill up. They fill up, and we've gone back to places where we've been before. And people are happy to have the information, but also quite frustrated that nobody's ever told them about it before.
I think that we could probably continue talking for another hour about this. It's phenomenal what we're learning about Parkinson's disease. This is Parkinson's Awareness Month. We've been talking to some of the people who are on the front line of raising awareness, raising funds, the researchers who are trying to make the connections in this and how to beat this disease that has no known cause, no known cure, but it certainly can be dealt with, and that lives can be made better, and that you can cope with this, and if you have the right kind of help and treatment, you can live a full life. Now, we can get more information. If you missed any of the part of this program, it will be on podcast, okay, under Talk. If you go to CIL 650, Parkinson.
BC.ca.
Parkinson.bc.ca. I almost got through the whole show and got it right. CEO of Parkinson Society BC is Jean Blake, who has guided us through this today. Thank you so much for bringing this to our attention and bringing in this wonderful group of people to talk about it.
Thank you, Gordon. It was a wonderful opportunity. And besides the website, let the listeners know that we have a wonderful toll-free information and referral line. And if you're outside of the Vancouver number, it's 1-800-668-3330. And our staff are happy to provide information, educational pieces. We do counseling. We do consultations. So if you need more information, please have a look there, and or of course our website. We do also really rely on just individual donations to run all of our programs and services. So we have our major fundraiser coming up, not till September, but mark it in your calendar for September 10th or 11th, depending on your community. There are 22 walks in various communities across British Columbia.
Well, the 13,000 people who are dealing with Parkinson's disease here in BC alone, appreciative, I'm sure, of the work that you are doing, and everybody else that we talked to today. Thank you so much. This is Boomer Life on CIL 650.